Thanks. Heart disease, still the #1 killer of both men and women in the United States. More than 600,000 people die each year of heart disease. How can you make sure you're not one of the statistics? Well, you might want to check out a free health forum happening this coming Friday. Cardiologist Dr. Timothy Byrne joins us along with Tammy Query. Did I say that right?
Yes.
Okay, good. I just ran in here. I feel so bad. I didn't get the names down. She's the director of the Cardiovascular Center at Abrazo, Arizona Heart Hospital. First, what's going to be at this forum, guys? What can people expect if they show up?
This is an educational opportunity for the patients to see the innovations and the clinical research that we do so well at the Abrazo Care Network. Okay, we will be showing some interventional and innovative procedures that the patients can view live as the physicians are performing.
Wow, interesting.
And you'll also see, I think what we do best is that patient-centered touch. We're going to have some testimonials from some patients to share their experiences that have happened to them at our heart hospital.
When we talk about advancements in medicine, this is an area, obviously, it's a big focus given the amount of people that die of heart disease every year. What's happening behind the scenes? What kind of medicine can people look forward to if they are indeed affected by heart disease?
Well, there's a lot of innovative procedures out there now, including the TAVR device, the TCAR, and the CardioMEMS device that are less invasive ways to treat these kind of diseases. And as opposed to the traditional open heart surgery where they crack the patient's chest open, there's a lot of transcatheter procedures that are going on now to treat them, where they have less hospital stay, shortened recovery, and better outcomes.
Yeah, it's amazing because it wasn't all that long ago where that was the standard, and I'm sure still is in some places, but the medicine is advancing so fast. Tell us more about the transcatheter because it is something that will be on display at the forum, as I understand.
Right. The transcatheter aortic valve replacement, and we are involved in a clinical trial. The device has been proven already in high, extreme, and intermediate risk patients. We're now part of a clinical trial that looks at standard risk patients. So Ryan, if you came to us and needed a valve replacement procedure, you would be randomized. There'd be a 50-50 shot that you could get the open procedure or you could get the transcatheter procedure. And that is going to really open the door, I think, to having this be proven as a standard of care. Less stroke, less chance of dying, shorter hospital stays, and you get quality and you get life. Your prognosis with aortic stenosis is worse than almost the worst cancer.
Wow.
So if you have symptomatic aortic stenosis, that's a narrowing of the heart valve. The valve doesn't open normally. Your chance of dying if you present with heart failure is 50% at 1 year. That's worse than almost the worst cancer.
Unbelievable.
You get the valve treated, it's just like you never had the disease.
I'd be remiss if I didn't ask about prevention. We have just a couple of seconds here. As medical professionals, what is your message to people out there to prevent heart disease, to be healthier people?
I would say the prevention lies with the patient in their choice of diet and their activity level and exercise to start with.
And let's get the information about the event up right now. Tell us about it, when and where.
It's at the Pointe Tapatio Cliffs. It's Friday night. It's going to be really exciting. You'll learn a lot more detail about how to prevent heart disease. 1 in 4 deaths in the United States are caused from heart disease. 1 in 4 deaths.
And we have free cholesterol screenings, blood pressure checks. It'll be great.
Crucial to stay up to date on that stuff and to get screened regularly. Guys, thank you so much for being in here. A great event. I can't wait to hear more about it.